A warm welcome to today's talk, Saturday the 6th of February. Now, trends globally are going down at the moment, and that's what we want to discuss today. Is this real? Is trends actually going, cases actually going down? Are they likely to go back up again? And we're going to start off with a couple of graphs. Now, this pretty well uncanny drop, really. This is the UK here, very closely mirrored by the United States. This reduction in cases is good. Canada also favourable. Australia puts us all to shame, of course. Now, the bottom line on this really is the United Kingdom are moderately optimistic this is going to continue. The United States, it's very difficult to have an opinion on this. So I will be giving data that indicates that there could be a rebound in the States, nothing to do with opinions, and it's kind of hard to work it out at the moment, but there's certainly a risk. There's a risk in the UK, of course. I mean, people in the UK are calling for things to be opened up like yesterday, but the cases would just come back if they did that. So concerned that the US might go up, the United Kingdom slightly less concerned, because I think there's the political will in both political parties to make sure that the cases do go down this time. And of course, we're not a political channel, but the politicians, of course, influence everything that we do. So, but there is cross-party support in the UK for the Labour Party in the UK is actually more in favour of more rigorous lockdowns than the governing Conservative Party at the moment. So I don't think things are going to be bouncing back to opening quickly in the UK. So I'm fairly comfortable that's going to carry on going down in the UK. The United States will be looking at that in more detail. Ireland, we can see that the measures here have had dramatic effects. So Ireland was the highest per capita case for a while. And again, we see this trend of reducing cases. So it's looking remarkably good. And remember that this is despite the fact that the UK variant, the more transmissible variant, is highly prevalent, if not the most prevalent form now in Ireland. So that's they've done very well. There's no question about that. This represents dramatic success in the Republic of Ireland. Now, deaths. Now, the deaths are stubbornly high in the United States, going down slightly in Canada, starting to drop off in the United Kingdom now. But the deaths in the United States they're still high. It's still a terrible situation, but they will start to go down in the United States. That's inevitable because it is going to follow the reduction in cases, which is real. So a low high at the moment, that will definitely start to drop off. The only question is, of course, will it start picking up again if there's another wave? So that's what I wanted to look at there in terms of graphics. Now let's move on to a bit of detail. COVID symptom tracker app, and we can look at these figures here. So this is the position in various parts of the UK. Peruse that at leisure, and we see that basically we're a much lighter colour all over. Just over 18,000 new cases in 24 hours, so it's down a lot on the symptomatic cases. And this is the prevalence graph, and we see really it's going down in quite a sustained way. But we've still got 367,467 people in the UK with symptomatic coronavirus disease, COVID-19 disease now. So this hasn't gone away, it's just that we were appallingly high. But the direction is remarkably good. Remarkably good. And if we look at the official data from the government, then we see that's kind of that's reflected in this as well. We see this very encouraging downward trend in new cases. And as we've seen, the deaths are starting to drop off in the UK. Now, healthcare in the UK, although the number of new admissions are going down, which is great, they're still remarkably high. It's still nearly 3,000 people a day being hospitalised. Still very, very high, very, very stretched. And the number of people in hospital only going down slowly. So the pressure on the health services are still really, really significant, really significant. So moving on to the reduction, COVID symptom tracker data. Cases down 70% since New Year's peak, and this was published just yesterday, the 5th of February. So daily average UK symptomatic cases over the past few days, lower than that now, but that's the average over the past few days. So coming down and gone down further even now as we speak. And this is based on swab test data from up to 5 days ago. So this is delayed. That's the swab test data, and as we saw, the actual symptomatic prevalence, which is more lifetime data, still going down even more. So that's good. Now, this is based on lots of swab tests, around 1 million weekly reports, the proportion of new symptomatic users who have positive swab tests. So people fill out their swab test results on this app, and it gives good data. So data from 15,286 recent swab tests done between the 17th and 31st of January is what this reduction is based on. And the week before, the new cases were plus 28,000 a day. So we've gone down from over 28,000 UK symptomatic cases per day to a recent average based on 5 days ago of 20,000. And now, as we saw on this, the latest 24-hour period was 18,189. So this is a very good trajectory that is being followed, consistent with the government data. No question that this is a real dramatic drop-off in cases. In the week, a drop-off of reduced cases 29%. Bear in mind the peak on the 1st of January will peak at nearly 70,000 new cases per day. I mean, massive, unsustainable numbers. And it's down 70% since then. Now, the prevalence in the UK is also going down. Prevalence is the number of people with the infection at any one time. So 1 in 70 people in the UK are currently symptomatic. 1 in 170 rather. 1 in 170 people. Now, again, a dramatic reduction. That's of the 5th of February. That's yesterday's data. But the Office for National Statistics, the week ending, so that's for the 7 days up to the 30th of January, it was 1 in 65. So it looks like we've gone down, I know it's 2 different ways of gathering data, but down from 1 in 65 to 1 in 170. I mean, this is just really quite, it's pretty encouraging. The direction is good. The overall numbers are high. Let's not get away from that. We are not there yet, but the direction is good. Dorset, Bournemouth, Christchurch and Poole slightly higher, 1 in 100. London 1 in 102. Liverpool 1 in 122. But the UK overall value is 0.9. So it's not a lot under 1, but a bit. And it's pretty well the same all over. England 0.9, Wales 0.9, Scotland 0.9. So despite the some might say a balkanised approach taken in the UK by different local potentates and local governments and regional devolved government, I believe the expression is in the UK, the overall result is whatever people have done has come to pretty well the same place, and it's all below 1. East Midlands is slightly higher, so that means in other areas of England we're very slightly lower. But as we saw on the map, there's not a great deal of differences between areas. It's all fairly lightish pink in terms of new cases, certainly compared to where we have been. Now, cases are coming down in all age groups as well. So all age groups we're seeing a reduction. So that's good news. And that's despite the prevalence of the UK variant. We're still worried about the South Africa variant, of course. More on that in a minute. Now, other countries don't seem to have suffered as much as the UK and Ireland and Portugal from the new variants. So let's take a look at an example. Now, this is from Anthony in France, who is my French translator. Thank you, Anthony. He takes this from the... Anthony doesn't want his full name published, but I know who he is and he's reliable. And he translates from French news outlets for me. So that's good. Just a short note, awaiting this week's government power wow announcement as to whether to shut down or not, basically, is the answer. Because France is actually going to... France are actually going to do anything about imminent growing problem of the UK variant. Are they going to do anything about it? Because the UK variant in France is now growing at over 60% week on week. And this is what happened in the UK. it went up dramatically. So the French government seemed to be 50-50 on whether to have a lockdown or not. Now, if they don't have restrictions, then the UK variant will become the most prevalent form of the virus, and cases will increase in France, as they did in Ireland, as they did in Portugal, as they did in the UK. So they've got decisions to make. It's 60% week on week. 14% of all cases now is the new UK variant. So that is bad. That is bad. It was only 5 or 6% last week. So this is what happened in the UK. The more transmissible variant simply outcompetes, out-evolves the older, less transmissible variant. It's increased transmission, or the increased transmissibility, that is driving this variant at the moment. Now, there's other evolutionary factors that are going to come into it later, but that's the main one at the moment. Still avoiding lockdown. Country is having a powwow about it. And this was obviously written in the evening, so good evening to you as well, Anthony, and thank you for translating and summarising the situation from the French media. Most useful. Now, I don't know what to say, really. It's going to be interesting to see which way the French authorities jump. I just hope they realise what's at stake, because that's what we've been through in the UK and we've suffered from it. I hope they are sufficiently proactive, but we will see. The French government will have to decide. Now, the infections are going down in the United States. Now, this is remarkably good news. Let's look at some here. So, official cases, 26.5 million. If I can move that across, which I don't seem to be able to do. Yes, I can. 26.5 million cases officially diagnosed, vaccines administered, 36.8 million deaths. Deaths are high, 454,000. But the trend of cases is going down nicely, which is simply great. As we've noted, the deaths is not. It's still high, but with the lag, the deaths will go down with the cases. So it is quite inevitable that the deaths will go down in the United States, which of course is good. But we do notice that the deaths are really remarkably high still. I know this is for the whole country, but we're still looking at well over 3,000 deaths per day, a 7-day rolling average. 3,227 deaths per day. But why are the cases going down? Now, this is a bit hard to try and work out, really, but there's a few factors here. So, natural infections and vaccinations. Now, we've seen that the US has done, how many vaccinations was it? Well over 36. It's on the cases one, wasn't it? There it is. Well over 36 million. And people will start to get levels of immunity perhaps 2 weeks after the first shot. 2 weeks after the first shot. Now, I'm going to look at data from the UK in more detail, not today, but probably tomorrow. It shows that for the first 12 days after vaccination, you get no protection at all. But after 12 days, the protection does start to build up really dramatically and quickly. So, is this a factor in the US? Natural infections, yes, I think that's a factor, because there's probably getting on for 100 million of them now, so there's a level of immunity there. Vaccinations, yes, it's a bit of a factor, but it gets a very small tick because it's only starting to trickle in now. And when I say trickle in, I really do mean trickle in. This is not a big factor yet, not a big factor at all. Post-holiday surge is probably over. There is reduced travel in the US. Millions of people are learning a new normal, less family interaction overall over the whole country. So millions of individual and family behaviours have improved. Gatherings are down. Mask wearing is becoming normalised. Now, I know there are exceptions, and we see videos of... I saw a video of a supermarket in Florida with no one wearing masks, but these are the exceptions now in the US. Mask wearing is becoming normal. No holidays now till Memorial Day in May, so that's a way off. Any gathering will cause contagious variants to spread because of the trouble with more contagious variants. Variants of concern may cause an increase in cases in April. is this going to happen? Is there going to be an increase in cases in the United States in April as a result of variants of concern? Late March and April, the answer is I think there could well be, but we're going to look at data on that in a minute. Herd immunity is coming, but not yet. Now, part of the problem with the vaccination programme are people are saying goody goody gumdrops, vaccines, we're all okay. Well, that will be the case in 6 to 9 months' time. It is not, emphatically not, the case yet. We have to carry on absolutely as normal, whether you've had the vaccine or not. Cases are still very high. Yes, the directions in the UK and the US are good, but they're still coming down from a remarkably high plateau. We are still at altitude. We can't camp at this level. We've got to carry on going down. So there's some links from the US site. New daily reported cases down 18.8% in the past 7 days. Deaths up 0.3%, unfortunately, but in the next week or two, this will be going down. This will be going down. But again, from a very high level, well over 3,000 deaths per day. COVID-related hospitalisations down 14.1%, but still high, as in the UK, coming down relatively slowly. Test positivity rate down to 7.4, well above the epidemic threshold of 5%, but down from what it was. And the vaccine programme is rolling out. I think the US, I haven't got the latest daily figures in front of me, but I think it's well over 1 million vaccines per day. So it is happening, but it's not going to kick in terms of herd immunity yet. So started on the 14th of December, 38 million doses. And again, this is 24 hours out of date. That kind of puts it into perspective. 2.46% of the population have had both doses, which is the strategy in the US, unlike the one-dose strategy in the UK. Now, the data that was concerning me, which I'm going to go on to now, comes from the Institute of Health Metrics. And there's some forecasts here. Washington State University, based in Seattle. Now, the forecasts here include distribution in the presence of B117, that's the UK variant, so that's factored in. Now, what they're worried about is widespread spread of B1315, the South African variant of concern. This seems to be the big thing. So this has got this factored in already. This is the one that they're worried about now. And we know that although the genomic testing has been improved dramatically in the United States, it's still pretty low actually, compared to UK or Denmark, way low. So the complete position on these B117 and B1351 are not entirely clear. Now, if mobility returns to pre-pandemic level in the vaccinated, so they're worried about people that are vaccinated even. Now, remember the vaccine reduced transmission by 67% in the UK. But that still leaves quite a lot of people that are vaccinated that could potentially transmit. So I think that might be what they're worried about. They're worried about that if everyone who's vaccinated just starts gadding around as they did before, then there's going to be a problem. And of course, I would agree with that. So what they're saying is, if there's widespread transmission of the South Africa variant, and if there's increased mobility, that is going to result in 654,000 deaths by the 1st of May. So that's well over another 200,000 people could die based on that unfortunate scenario. Without the B1351, just with the UK variant, that can still be 559,000 deaths by the 1st of May. So we see that the South Africa variant will be resulting in approximately 60,000 more potential deaths in the United States. So this could lead to a resurgence of cases in spring. The combination of the B117, the UK variant and the South Africa variant, and potentially they didn't actually model for the Brazilian variant. That could be a factor as well. There could be a resurgence of cases in spring. in some states, and they highlight California and Florida as being particularly at risk. So keep mobility low, maintain social distances, will result in the saving of 30,000 lives. It's up to the United States whether they do that or not. Now, Christopher Murray, director of the Institute of Health Metrics and Evaluation, getting vaccines quickly is essential, and masks are still one of the best tools to keep transmission low. So we've got the non-pharmaceutical interventions that have not gone away. They need to stay. People will need to continue taking precautions once they are vaccinated. Absolutely, vaccination should not change behaviour yet, as you are no doubt fed up of me saying. Some states are not reimposing social distancing mandates even when death rates are high, so there will be more spread. Herd immunity unlikely to slow transmission in the coming months. It's going to take longer, so we must behave the same. High levels of immunity are needed with a more contagious variant, so herd immunity now is going to be 80% or 85%. People are going to have to be immune, perhaps 85%, to get herd immunity effects. Long way off that yet. Institute for Health Metrics and Evaluation forecasts predicted only 83% of people in the US will be immune by the 1st of May. So that leaves getting on for the other 60% of the population, 62% of the population still at risk, still transmitting. And they're also worried about vaccine hesitancy, which I'm not too worried about yet. I think that's going to sort of dissolve away to a large extent, although maybe less so in the US. But if there is vaccine hesitancy, that could result in a third wave next winter, which we do not want. Governments and public need to plan for the real prospect that COVID-19 must be managed on an ongoing basis. Okay, let's hope not, but certainly for a few seasons it's true. It's critical to vaccinate as many people as possible, of course, and to prepare for long-term behavioural change. So the behavioural change is not going to stop in the next 2 or 3 years, potentially, because this is going to take a few seasons to get rid of this virus. Now, let's just go into some better news before we get a special report from Australia. US trial looking at vitamin D, which is good. So I'm going to give this a bit of an ad. They're looking for people who've just been diagnosed with COVID-19. So the link is there, and they're going to give them vitamin D. We've talked with this lady's been on the show before. I'd love to interview her. She's a very seems to be quite a big vitamin D advocate. And then the thing I like about the States is it's got all the nice pictures of all the people that are doing the research. So here we see this pretty high-powered team, it has to be said, who are doing this doing this research. Now, the thing that concerned me about this research was they seem to be giving vitamin D, and we know it takes time. Now, these are clever people. They've obviously thought of this, but it's not written down. So that's the trial website there. Now, cholecalciferol is vitamin D3, which they seem to be talking about giving. But we know that takes at least a week to be converted into calcifidiol, the active form in the blood. So if you give someone who's just diagnosed with COVID vitamin D, that's not going to get into the active form for about 7 or 8 days in the blood. So I don't see it's going to influence the immediate course of the disease. But they must know that. And if they would like to come onto the the channel and talk about it, they would be welcomed with open arms, of course. So they must know that. But in the literature, they do say vitamin D. So right, heading into autumn and winter. Now remember, we're in the northern hemisphere, so for us we're going into spring. Argentina, Australia, South America, they're all going the other way. They're going into winter, because they do things back to front because they're in the southern hemisphere. So issues potentially there, let's hope not. Australia, time to start vaccinating. Why on earth aren't the Australians vaccinating? I have no idea. Now, there's been a bit of a scare in Australia lately. So Nigel, who's recently retired medical doctor, has come on to talk to us about it. So Nigel, thank you very much, and over to you, sir. let's go.
So, hello, John. It's been a pleasure to provide this little report for you. I've been watching your stuff for almost a year now, since this pandemic has begun. Just a quick history. I'm from Western Australia. I retired about 18 months ago. I was a doctor. In about March last year, we went into a lockdown for 2 weeks. And after that, basically, lives have been pretty normal here in Western Australia. Pretty free to move around, although we have had hard borders in place with the eastern states and returning travellers. But that has allowed our life to be pretty reasonable since then, with very few restrictions. However, last Sunday, the 31st of January, we had the first case for 10 months of a community spread, and it was in a security guard in a hotel that was used for quarantining. On the floor that he was looking after, there was several positive cases, one of which was the UK variant. And it proved that he'd got the UK variant. So he got his positive PCR test on the Sunday morning, and our government in Western Australia reacted very quickly, and we had a snap lockdown. So by 6 p.m. that day, we were in lockdown. And since then, we have had no new cases of community spread. There have been a couple in the hotels that are quarantining overseas travellers, but there have been no community spread. And that includes this security guard's 3 flatmates and his very close contacts that have all been tested. I believe most of them have now been tested twice, and all have returned negative tests. So today, when I'm doing this, it's Sunday, the 5th of Feb, and our lockdown has been eased slightly since 6 p.m, and we're now allowed to move around a little bit more freely. We've still got quite a few restrictions. We still have to wear a mask when going out. And we also have what's called Safe WA. It's an app on your phone, and all premises have got a QR code at the entrance, and you scan that QR code into the app, and then that can be used for contact tracing. And I do believe that that's how they managed to contact trace this guy's places he'd been a lot faster than it would have been. So all our shops are now open again. Schools are going to open on Monday. They were due to open on Monday last week, but that was canned. But schools are now open. So basically we have to wear a mask when out. The only people that don't are children under the age of 11 or 12, I think, primary school age and below. Otherwise, we wear a mask unless we're doing vigorous exercise outside. I'm not sure I understand some of these bureaucratic rules, but there it is. So, for instance, if I'm out driving on my own, I don't have to put the mask on until I get out the car. But if I'm driving with my wife in the passenger seat, we both have to wear a mask. I'm not sure I understand the logical reasoning behind this, because we're allowed to walk around the house without a mask together. Still, then hopefully our vaccine program's going to start very soon. It's been a bit slow off the mark, but really we haven't had very many cases in Australia. Western Australia has only just had over 900 cases in the last 12 months. So not a lot. We've got a population of 2.6 million. So we really have kept this pandemic out very effectively. Our federal government has basically said, we don't need to rush into this vaccine. We're going to take it slow and steady because there's very little disease here. And I can understand the logic behind that. The Therapeutic Goods Administration, the TGA, which is responsible for approving treatments, has approved the Pfizer vaccine, and they are looking at the Oxford AstraZeneca vaccine as well. The Pfizer vaccine rollout is supposed to start by the end of this month. We're not expecting the AstraZeneca vaccine to be approved until March, and then hopefully its rollout will start at the end of March. And as usual, like it is in England, the people that will be getting the vaccine first are the frontline workers, aged care residents and aged care workers. Then it will move on to the elderly and those with comorbidities, and then it will be in age groups. I'm in that 50 to 69 age bracket, which is the third group down that should be getting the vaccine. They have estimated, therefore, that those people in the age group will get their first vaccine in May, I expect June. And then all the others will be rolled out down to the 18-year-olds. I'm not sure what countries are doing at the moment with the under 18s and their vaccinations. So that's a quick update basically on what's happening in Western Australia, and I hope that you found this helpful, and keep up the good work. Thank you.
I am back on. That's good. Sometimes I forget to turn my microphone off. Nigel, excellent. Thank you so much. No need to go over that. Absolutely clear. I just want to show you one picture that just reinforces the success. This is from the Australian website. 0 new local cases overnight. And just to rub it in, 0 Monday, 0 Tuesday, Wednesday, Thursday, Friday. And Nigel has outlined why that is. Lesson learnt from Australia. If you are in the UK, Europe, the United States, or basically anywhere in the world apart from Australia and New Zealand. So, great report, Nigel, Western Australia. I'm not sure if you live in Perth, but around about that area anyway in Western Australia. So great stuff. Thank you very much. And thank you to you for watching this update.